understand the cynicism and the skepticism. It is not without cause. The Tuskegee experiment is a terrible stain on the soul of this nation. The system does have biases and injustices, but that is not true in the case of this vaccine. One of our pressing challenges is to make sure that the vaccine is made available fairly. COVID exposed many existing injustices in our society. It showed us the health disparities that exist and how many communities don't have fair access to health care. COVID showed that racism is a public health crisis also. COVID killed black people in this country at 2 times the rate of white people, and Hispanic people at 1.5 times the rate of white people. Testing for COVID was more available in richer, whiter communities, and the infection rate was higher in black, Hispanic, and poor communities. This can't happen again, and it can't happen with this vaccine. In New York, we're committed to making the vaccine available to everyone, everywhere. We have a special task force headed by Attorney General Leticia James, National Urban League President Mark Morial, Secretary of State Rossana Rosado, and Healthcare First President Pat Wang. Your pastor, the Honorable Reverend Dr. Calvin Butts, a great talent, will serve on that task force. We are designing special portable units that can be pop-up vaccination sites and brought to public housing authorities, churches, and community centers around the state. I understand that people are skeptical about government. When I was a young boy watching TV with my grandfather, my father's father, every time a politician would come on TV, he would do this and make me change the channel. One day I asked him, I said, "Grandpa, what's this?" And he said, "Oh, politicians. That's all they do is talk, 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 and they do nothing." Now, he didn't do that when my father was on the television speaking, but my father was different. He was not a typical politician, and neither am I. I am committed to social and racial justice in the distribution of this vaccine. It will be available as fairly and as quickly as we can make it happen. Race or income will not determine who lives and who dies. And I mean it. And that's why I say to you today that I want to take the vaccine. I move around a lot and come into contact with many people, and I would feel much safer if I took the vaccine. But I will not take the vaccine until the vaccine is available for my group in black, Hispanic, and poor communities around the state. The governor's license plate is number 1. Big deal. The good book says, "The first shall be last and the last shall be first," Matthew 20:16. Until the vaccine is available in the South Bronx and the east side of Buffalo and Wyandanch and South Jamaica and Edgerton and East Utica, our healthcare deserts, our job is not done. I'll do my part, but you have to do your part. We all need to have faith and trust in the vaccine, and we need to have generosity in our souls, where we act for the good of one another. The good book says in Paul's epistle to the Galatians, carry each other's burdens. That is our mission today. 2021 will be what we make it. We are New York tough. Let's make it smart and loving and caring and safer and fairer and sweeter than any year thus far. Together, I know we can do it. And together we can set a new example of what community really means. And let New York lead the way. Thank you.